You're listening to A Second Look on the Orca. A second look is an opportunity for all of us to reflect on past events, unpack their significance, and discuss their long-term implications. A second look is intended to give thoughtful reflection on issues that made the headlines and elicited strong responses as a society. What did we think then? What do we think now? What have we learned? And now, your host, Justin Goodrich.
Welcome to this month's edition of A Second Look here on the Orca. I'm your host, Justin Goodrich. This month, we take a second look at the opioid crisis as part of the 5-year anniversary of it being declared a public health emergency by the provincial government. To discuss the events of the past 5 years, we are joined by Jeff Hardin and Madeleine Hardin of LifeGuard Digital Health, the revolutionary new app that has been credited for saving dozens of lives since its rollout last May. Welcome to the program.
Thanks, Justin.
Well, I'm thrilled that both of you have made time to be here today. Very appreciative of you. Obviously, this public health crisis continues to be top of mind for all of us. In addition to, of course, the current pandemic, in some ways, I think perhaps it's received less attention as a result of the pandemic. All the more reason to be taking a second look at the past 5 years and what it's meant. Jeff, I'd like to start maybe a little bit with your story, so listeners have a sense of who you are, what you're about, and what ultimately brought you to where you are today as the CEO of LifeGuard.
You know, Justin, my story is not that uncommon in this crisis or in addiction. My background, I had a good family life. I came from a good family. I've got 3 brothers, 2 sisters. You know, my problems with alcohol specifically didn't come till later in my life. It didn't come until my 20s. Sure, I drank through some of high school, like a lot of people did, but it really didn't affect me or affect my life until I got into a work environment where I started in sales when I was right out of college. And I enjoyed that career. I worked in the office equipment industry, and it was very competitive, which is a background that I came from in sports. And you know, there was celebration, a lot of it, and there was celebration if you did well. And I seemed to excel at that particular in that industry, and there seemed to always be a celebration. And I developed an extremely unhealthy relationship with alcohol, and that continued right through my 20s, my 30s. I ended up in court a few times. I got an impaired charge, and even that, you know, didn't deter me from my focus on drinking. My career still carried on, and I was able to, ironically enough, keep my career going, masking my drinking, because of course it was all kind of rolled into what I did anyways. But you know, as my career progressed and my addiction had progressed, you know, things started to deteriorate. My relationships at home, my relationships with my parents and my siblings were not the same. There was a lot of discussions about where alcohol was taking my life, and that it was affecting decisions that I was making, how it was affecting my decisions with my kids. So along came my first attempt at treatment, and I did that in 2010, and I went to a treatment center on Bowen Island here in the Lower Mainland. And my battle with alcohol still continued. I came back after a couple of weeks and thought I was all better, and things only got worse. But you know, funny, as I was hiding my addiction and trying to do better in my career, I guess I felt that there was a place and a time in my career there in 2008 that I left and started my own business in the same industry. And I was extremely excited about that. And we started a dealership in the Lower Mainland, and that went on I had that for about 3 or 4 years. It did very well. We were the top dealership in Western Canada 2 years in a row for Konica Minolta. And it was a great time. But through all that, and again, celebration, my drinking continued, and my drinking got worse and worse and worse. And it would be unfair if I didn't mention as well that cocaine started to enter my life at that time. And I can tell you, with that combination, things started to deteriorate and fall apart real fast. My the sort of ending, sort of the bottom rock for me was it was October of 2016, when I tried to contact my daughter, and at this point I had actually got to the bottom. My wife and I had separated, and my kids weren't talking to me anymore. My company had shut down. It was closed down. We didn't pay our rent. We owed money to CRA. It was a disaster, and more of a nightmare, not just for me, but for my wife and my kids and my family. And being in my addiction, I didn't see any of that. I saw what I needed to see in front of me, and I didn't think things were actually that bad, to be honest. But at that point, my wife did, and she'd had enough, and I was in a very nice way asked to leave the house. And I would say that it was a bit more stern than that, but I was kicked out of the house, and I was on my own for about 2.5 years. I was out for 6 months trying to get into treatment. I was trying to get my head on straight, and I wasn't there yet for about 6 months. But after 6 months, I found my way into a treatment center again. And just to get the numbers right, this is number 6 this time. So the first 1, 2, 3, 4, 5 didn't quite take. But again, I tell people when I share the story, all of those times that I went, I did it for somebody else. One time I did it as a court order. One time I did it for my wife. I did it for my parents. I did it for my kids. And those of you who have been through addiction and have tried to attempt to get out and have gotten out and been successful, the success rates skyrocket when the initiative is by somebody from an internal place, not an external where somebody gets somebody else to go. Sure, if you're motivated to get up and go on your own, and you've decided that I've had enough, then your rates of success go way up through the roof. That's where I was. No, I didn't know that's what was going to happen. I didn't know when I entered treatment that time that things were going to change to that level. All I knew, though, was that I had nothing. Sorry.
It's all right. It's all right. Take a beat. Take a beat.
And I wanted my family back, and I didn't care what it was going to take at that time. I was going to do whatever it took to get my wife and my kids back. And even if they weren't going to come back, I felt that I needed to put them back whole, if that makes any sure, if that makes sense. I'd taken so much, financially, and, I was such a burden for years that I felt that even if my wife wouldn't come back, that I at least needed to do that. So that was my focus and my motivation, was to get healthy, get myself back on track, and try to at least be there for my kids and my wife, if they would even let me, even if they talk to me. So on October 16th, October 24th, 2016, I tried to call my daughter. It was her 16th birthday. And I have a very close relationship with her. And she wouldn't even pick up the phone. So I had to call from somebody else's phone because I was blocked. And she picked up the phone, and she, finally realized it was me. And she said to me, I wouldn't even come to your funeral if you died. So don't call me. So that was it. That was my bottom line. So I can tell you right now that's October 24th, 2021 will be my 5-year anniversary of being clean and sober. So wow. Yeah, so it was to hear your daughter say something like that. It changes you. It changes you. It changes who you are. It did for me. And at that point, my life changed dramatically. I found a relationship with the Lord. I dedicated everything I had to becoming sober, and to getting myself back to them. But also, there was another stumbling block, because I was unemployed, and I wasn't even employed. I didn't even think I was employable. So, after about 1.5 years in treatment, and treatment, which was more of a 30, 60, 90-day thing I did before, this time I didn't have anything to go back to. I had no money. I had no job. I had nowhere to go, which was the best thing for me, because I couldn't leave treatment, and I needed treatment for at least that 2 to 2.5 years. And I know that now. And while I was there and changing myself and changing everything from the ground up. I had to rebuild my life completely. I developed a friendship with somebody by the name of Evan. And Evan, if you've been on our website or have read any of our literature, the company itself has dedicated itself to the remembrance of Evan. Evan was my friend at treatment at Phoenix. He was sober for about 6 or 7 months. He got himself a job. He was doing great. He decided one day that coming home from work, he was going to use one more time. And he did that while he was by himself. And he wasn't found for 2 days later. He had suffered an overdose. And to understand who this gentleman was, he was such a gregarious, loving, young, beautiful guy. And he himself had a young daughter that he had to put up for adoption, and because of his addiction. And that's where we kind of bonded and became friends. I was more kind of, I'd say, more of an older brother to him. I was 48, he was 27, but very lovable guy. And we became good friends, and this had happened. And you know, Madeleine's gonna laugh because I say it all the time. I'm just trying to find something here. This roll of Scotch tape right here, like, it's got more technical ability than I do. Like I can, like, we're talking about computers, and you know, I don't even run off a computer. My E just set this up. I use my phone. I'm not a technological friendly savvy guy is what I'm trying to say. But
Sure.
there's more to this story, because, and it's bigger than me, obviously, because I just started, after this happened, we were all sort of mourning, and I got this idea, you know, there's got to be a way. Everybody uses a cell phone. There's got to be something that can happen with a cell phone to get help. And I just started drawing diagrams and had some ideas, talked to people, researched, and a real simple sort of idea about how can we get a cell phone to throw an alert, get an alert to emergency services. How could that happen? And literally, it just started to build that day from there. So I drew a bunch of diagrams and different screens of what I thought could happen, not building off a technological platform because I didn't really know any. And I started to think about getting a developer and getting some people to help. So I Googled developers in Vancouver. I got three that I contacted. Only one called me back. And he was very friendly and was great. And we ended up doing business with this gentleman and his company. The funny part of that is he wanted $50,000. And that actually, now that I've been out there and I've done it, that was fair. But not for a guy that had about 25 cents in his pocket. And this gentleman didn't know that I was talking to him from treatment. And I went, and all I could get, I borrowed $500 from my mom, and I phoned him up and I said, I got $500. And he said, okay, let's get started. And that's what happened. And, you know, it's miracles were flying everywhere. Like I met up with Madeleine. Madeleine had connections to some government people, one in particular who got us right to Parliament. We did a presentation to Judy Darcy, the minister at that time of mental health and addictions. I mean, how does that happen? We're only not even 6 months old as a company, and we're at Parliament, right?
So Jeff, you've shared a lot, you've got such an extraordinarily compelling story, and I'm glad that we've sort of got into the genesis of the LifeGuard digital health app.
Yeah.
Before we unpack that a little bit further, though, I'd like to ask you and Madeleine, given what it is that you do and the data that you have and the things that you are seeing firsthand, give our listeners a sense of sort of give us the state of the union of the current crisis. What does it look like today as compared to 5 years ago? Where are we at? What needs to change? Let's unpack the crisis first, and then we'll move into the application of the tool itself. But what can the two of you tell me about the current state of the opioid crisis?
Feel free, Matt.
Oh, if you don't mind, I'll just jump in here. Since this was declared a crisis, a public health crisis 5 years ago, we've seen deaths increase almost every year. This last year, there's been a 74% increase over 2019. So in 2020, there were over 5 deaths a day in British Columbia. And more people died of opioid poisoning. We call it poisoning because a lot of people don't know the drug is in the other drugs they're taking. More people died of opioid poisoning than died of COVID in British Columbia last year. and it's a real crisis. It's one that the government acknowledges as a real crisis, and our app is one, excuse me, tool in the toolbox to help save people's lives.
So it's disheartening to hear that the numbers have in fact been going up. Do you two have a sense as to why those numbers might be going up, or is that a bit of a mystery?
Well, I mean, we can't say definitively, but certainly the pandemic hasn't helped. Supply chains are interrupted for illicit drugs. People are taking riskier and riskier chances. Um, People are isolated, and people die disproportionately when they're alone. Over almost 90% of deaths happen when people are alone, whether they're in a house, an SRO, a shelter, a car, a hotel.
Mm-hmm.
And so, people are more and more isolated than they ever have been before. And doing drugs alone kills people. And what our app does, in a way, it's kind of like a buddy system.
Hmm.
Because if you nod off and you can't respond, a first responder will come to you.
So let's I want to really just unpack two things for the balance of the show. One, I want to unpack what's actually happening on the streets and how it's being addressed. And then two, I want to finish by telling this extraordinary story of this app and helping our listeners understand it's how it's actually used and its subsequent implications. But over the course of the 5 years, as we take a second look at this being declared a crisis, what has that actually meant? How is that translated into government action, programs, policy dollars, or otherwise?
Well, we have a ministry devoted to mental health and addictions we never had before. We have dedicated staff who are working on it. We have people very, how shall I say, trying very hard to decriminalize small amounts of drugs for possession. We're trying to take away the stigma, because the people who are dying are, that we have a thing. If you think you know who's dying, you're wrong, because it's from every strata of society, every profession, every age group. Yes, predominantly male, but women and girls are dying too. Everywhere from 14-year-olds to 60-year-olds are dying.
Mm-hmm.
So what's being done? It's being taken seriously. Our public health officer, Dr. Henry, and our national public health officer, Dr. Tam, both acknowledge that it's a real problem. But what we need is, if you like, decriminalization of, I believe, of small amounts of drugs, and so that people can have a safe supply.
So we have okay. So what I'm hearing you say is that one of the things that hasn't yet happened but should take place is a legislative process that complements this new ministry and complements the activities that are already taking place. Is that fair?
That's fair. And to the credit of the city and the province of British Columbia, they are asking the federal government to step up.
Right, right. So I appreciate the additional context, and certainly as you rightly say, you can't say definitively what is exactly been the causation for the increase in death. So as you rightly point out, COVID certainly hasn't helped. Certainly decriminalization and safe supply makes common sense to me. So let's go back then to you, Jeff. You have this extraordinary lived experience, which you've been very vulnerable in sharing with our listeners. You hit this rock bottom. You've come to this realization that you and only you can make these changes, and that you need to be the motivation for you, as you say.
Yeah.
Others can't. So now here you are, you've got $500. You've got this developer who's saying, yeah, okay, let's get started. Tell our listeners about the LifeGuard digital health concept. Madeleine touched on it a little bit, sort of introduced it, but let's expand out. It's a buddy system, but maybe tell
Yeah.
listeners how it works.
Yeah. So the platform itself, in its very basic understanding, it brings emergency responders to people in crisis that need to be attended to by somebody from emergency services. So very simply, the applications are LifeGuard is on your Google or Apple store. You download it from there. It asks you the first time that you open it up some very basic, call it administrative questions. You have to verify that your phone number's correct and that sort of thing. And once that's done, that's it for LifeGuard in terms of starting it up or having to do any, I call it, administration or additions to it. Once you are in a position where you want to use, you open up the application on your phone, LifeGuard. It asks you only two questions. And the first one is, what kind of drugs are you going to use? And there's a drop-down menu. You touch the screen. It gives you 5 options. You pick one. The second question is, please confirm your address. So through GPS, it'll have picked up where you are. It gives you 3 different places where you can add in more detail. For example, if you're in the mall, Starbucks, back corner, northwest or whatever, you can add that in. Obviously, those details make it much easier for emergency responders to get to you directly. Once you confirm that address, it starts a timer, and it starts a 1-minute timer that it obviously goes backwards for a minute to 0. Once it gets down to 10 seconds, if you haven't turned the alarm off, or if you haven't turned the timer off, it will activate an alert and an alarm. And that sound gradually increases for the last 10 seconds of that timer. Once it gets to 0, it gives you another 5 seconds, and then it'll send a text message to emergency services. But during the time it's being transmitted, it converts to a text to voice. So when it lands on the dispatcher's desk, it'll give information, and it'll say there's an alert in Vancouver. The respondent has taken whatever types of drugs he selected at the time. Here's the location. The emergency responder will then phone that person by way of the phone number to confirm it's not a false call. And if not, they'll send an ambulance to pick up or to help that person to revive or provide naloxone, possibly a ride to the hospital. But that's in its basic how it works. Around that today, besides just the alarm and just the opioid alert piece, we've added in an 811 connection, a suicide line, a crisis line, a 911 direct connection outside of the app line. And we're adding all of these continual mental health features and services to try to bring services to people, not only what they need, but when they need it, more importantly, and give them those decisions at the tools that are right in their hand. And
so this is, oh, sorry, go ahead, Jeff.
no,
Apologies.
that's okay. Yep.
So I find this, I got so many questions that sort of come to mind now, but they'd probably be a little bit off topic. I have to admit, when I heard 1 minute and then 5 seconds, to me that sounds like a very short amount of time.
Yes.
So really, I mean, somebody could use, and I sound so naive, and I recognize that, but somebody within a minute from what they take could potentially become so unresponsive that they couldn't even so much as turn an alarm off.
But correct. Now there's some factors to that, and there's some points to take into consideration. 1 minute, depending on habit and threshold. And what I mean by that is different peoples have different habits and they have different thresholds of how much drugs that they can actually take.
Okay.
So through our information line, which we answer every day, all day long, so anybody that has the app can send in ideas. One of the main things, good point, Justin, is that 1 minute for a lot of people wasn't enough time. So right on the application and right in the body of the timer, it gives you a button to press for additional time. So you can add another 1, 3, or 5 minutes to that first minute. And that's been quite successful, as I said, depending on your threshold and what's your habit look like. Everybody's different. So we have addressed that issue, and you bang on with that question for sure.
Okay. Let me ask another one then. you started with $500 as someone who was willing to take you on.
Yep.
Like you, I'm not very tech savvy.
Yep.
I still have my pad of paper and notebook I use every
Me,
day.
I write on
And
everything here. I don't take anything
yeah,
to say. Yeah.
and sticky
Yep.
notes all across the front of my
Got
computer. I have
those.
sticky notes.
Yep.
How then is this thing funded? I mean, technology
Yeah.
is obviously not cheap. How is this thing funded?
Yeah. So, and that is a great question, and we've been asked it many times. I will tell you that we are a for-profit company. We do have a foundation that Madeleine works with us and runs for us, separate from the business part of LifeGuard. But we did I literally borrowed $500 from my mom, and then we borrowed what's called, a friends and family call it round. We
Okay.
raised money as we went. We had some very significant help from IRAP here in federal grant that we were able to get to be part of. But we like any small business, we've chipped and hammered and try to raise as much money as we can and try to keep it going. And it was very difficult, if not almost impossible, until we were able to finish an arrangement with the ministry here in BC, and they pay us for our efforts and they pay us for the services and we've been
Okay.
able. I'm
Great.
sorry. Yeah, yeah. So we've been able to keep them going. We have a great partnership with the ministry. And then whether you're familiar or aware, on Monday we just launched in Northwest Ontario. They also licensed the product to use in their area. So we're slowly but surely getting some money to be able to pay for our services. Our development team is consistently and always putting in building out our roadmap for new features and things and services. If you're on our website, you can see that we have other products that we're developing, working in the same sort of arena of helping people in crisis. We've got a new seniors care application that's going into medical trial next month. We have a public health safety one. So we're trying to use our platform and we put if not 105% of our money back into research and development here, and that's how we've kept it going. And it's been, Justin, the other part is that there's so many people that want to help that when push comes to shove, we always seem to be able to find rent money.
Hmm.
You know what I mean?
Sure.
There's always people that say, okay, these guys are doing good things. They're helping. Let's keep them going. So it's not easy, but we've been able to stay alive.
Well, by way of a final question, then, before we conclude our time, I'd like to ask both of you to offer your thoughts on what needs to change to really get a handle on this crisis. Because I imagine it'll be a pretty awesome day when apps like yours may not be required, in the
Right.
same way that, wouldn't it be awesome if one day we no longer required homeless shelters because everyone is housed? I think anyone who looks at life through the lens of social services and wanting to make the world better, we recognize that products and services and agencies exist because they're addressing shortfalls in society. What can we do to help mitigate this particular issue as a society? Is it legislative, or otherwise?
You want to answer me, Matt, or you want me to answer?
Well, it's a very complex question,
Yeah,
Justin.
it
Sure,
is actually.
Um,
Just, I mean, some honestly, just some, even if they're just intrinsic, gut type responses, like, wouldn't it be great if X, Y, or Z happened? Because that could be a game changer. Or if we took this step over here, we could see a change. I mean, you talked about one earlier, the notion of decriminalization of small amounts of drugs. But are there other things that come to mind?
well, I mean, if every child was loved well, and I mean, people who fall into addiction, of course, sometimes come from great families. Don't get me wrong, but addiction's a problem in our society. Whether it's workaholics, alcohol, drugs, you name it. We have very many addictive tendencies. And if we could somehow address those early on, sure, it would be great. But how do you do that? We haven't figured that one out, Justin.
Sure. No, no, fair enough. So maybe the next step is, in fact, continuing to do a deeper dive and having conversations about things exactly like that. What about you, Jeff? Any final thoughts on something you'd like to see changed?
Well, I'll tell you, my, with some personal experience, I think it's a change on all levels, not just government. I have to tell you, I applaud our government actually. I look at Bonnie Henry on TV sometimes, and I just don't know how they're keeping it together. I'll be honest with you. It doesn't matter whether you're conservative, NDP, it makes no difference. We're all in this right now together. And, this is something none of us have ever been involved before. So, sure, everybody's got an opinion, and the government right now are trying to do their best. But I will tell you what happened to me, as Madeleine said, I did come from a good family, but I'm one of the very fortunate ones. Most of my experience of helping people or researching, it isn't like that. It starts at a very young age. Normally it comes from other parents who also have had a drug or alcohol problem. And, guilt, shame, and remorse are three words that are used in addiction more than ever. And then the fourth one is the opposite of addiction is connection. So yes, if we can try to bring more awareness to the public that these people are suffering, not, they're not out there and let's turn our head from these people. They're out there because they're actually suffering. Like there's things in our environment that we all are all up against that just these people didn't quite come out the other end the same way. And so what? But so bringing acknowledgement and awareness and having the ability to get treatment when you need it. And I'm going to give an example about that. Yes, the government tries to and are trying to open up more beds, and they're trying to get more homeless shelters, and they're trying their very hardest. I find that a lot of those beds are filled with people that everyone deserves a chance. Please don't get me wrong. But most of the people that are in treatment are there and they don't want to be there. I've been in treatment 6 times, and I can tell you that they're there for other reasons. And that's a difficult one, but to try to make a long story short, if we were able to capture faster and better that moment of time when somebody reaches out for help and they say, I want help right now, and take it immediately and pick them up, get them off wherever they are and get them somewhere, not, okay, go see a drug and alcohol counselor and we'll get you on a waiting list. And then 3 months later, and again, please don't take this the wrong way. I know the government's trying to do the best that they are. I just think that if everyone's serious, that is the time and the moment that you need to get somebody help is when they ask, because if you don't get them help, then it's that circle of the guilt, shame, remorse. They start it all over again, and good luck trying to find that moment that comes back. It'll be months, years, decades, or somebody's going to die again. So awareness. And, the other thing is look to people who have had lived experience, more forums, more groups get those portals open from people who have actually lived it, and get some decisions and ideas coming from that part of the world. But I think that with this pandemic, we've had the good part of the pandemic is we've been forced to make decisions that we didn't make before. And here we are. The app has been, rolled out. There's a lot more different solutions that are being looked at by the government, not just the typical ones. Technology is obviously being asked to be brought in. So they're looking outside of the box in regards to even Canada. What does the rest of the world have to offer? So I think that the public coming together and trying to battle this thing, and political walls coming down, I think we're in a better place than we've been for a very long time, if not ever. And I'm hoping that now we can really take what we've learned and build from it. And, we're only trying to expand our application further and further and further, and help to save more and more lives and bring awareness to the LifeGuard application.
Jeff, Madeleine, I want to thank you both for your time today. It's certainly been incredibly enlightening, and I value both of you. So thank you.
Justin, that's been great. Thank you very much.
Thanks, Justin.
Appreciate it.
Well, this brings us to the end of this month's edition of A Second Look. I'd like to thank my guests, Jeff Hardy and Madeleine Hardin, for joining me for today's discussion. as we took a second look at the state of the opioid crisis since being declared a public health emergency 5 years ago. Certainly my takeaway today is that all of us as a society continue to have a role to play in every facet, from opening doors and creating opportunities for more discussion to the ongoing destigmatization of those who are battling addictions. Until next time, I'm Justin Goodrich. Thanks for listening.
The preceding program was brought to you by Alliance Public Affairs Group in association with Van Grio. If you have any questions or comments about today's episode, please email us at asecondlook@theorca.ca. Thank you for listening, and please remember to like and share.